Welcome to Coaching Healthcare Leaders, where we transform great physicians and healthcare professionals into exceptional leaders. I'm Dr. Lisa, an executive leadership coach dedicated to helping healthcare leaders navigate the complex intersection of clinical excellence and organizational leadership. My mission is to give healthcare leaders a voice to help build sustainable health systems where everyone feels valued, healthcare workers want to stay and grow, and patient outcomes improve. Each episode, we'll tackle real challenges faced by medical leaders like you, provide actionable strategies, and feature live coaching sessions with healthcare leaders. Let's grow together. Hello, everyone, and welcome to another episode of Coaching Healthcare Leaders. So I am your host, Dr. Lisa, and I have an amazing guest with me today, and her name is Dr. Tanya Harris. So I'm going to read her bio and then bring her on, and we'll get into some interesting questions. You'll learn all about her and her background. So Dr. Tanya Harris received her MD from Philadelphia's Temple University School of Medicine in 2002. Dr. Harris has dedicated over 20 years to growing her primary field of physical medicine and rehabilitation. Starting in Virginia, she opened and ran a practice in neuro rehab before serving our veterans as a TBI polytrauma medical director at the Bay Pines VA in Florida. There, she helped develop a concussion coach app for OIF/OEF veterans. She was then recruited as CMO for New Zealand's largest rehab group, where she grew the country's PM&R residency by 50%. She also developed the concussion protocol for Oceania's rugby league. In the midst of the COVID pandemic, she returned stateside, where she opened a freestanding rehab hospital in Texas. Presently, she serves as medical director for one of 3 level 1 trauma rehab hospitals in Washington state, where she always aims to reduce disability by bolstering function and quality of life in her patients. She also maintains subspecialty board certification in brain injury medicine and electrodiagnostic medicine. An advocate in medical education, she has lectured at various medical schools and residencies in the U.S. and abroad. And in her free time, she mentors medical students and residents and also volunteers as board examiner for the American Board of Physical Medicine. So welcome to the podcast, Dr. Harris.
Thanks for having me, Dr. Lisa.
Yes, absolutely. So I'm always amazed, to read the bios of my colleagues, and you've done so much in your field, and also have given so much of your time. So share with us your career journey in the healthcare field, and how did you arrive at your current situation?
I was one of those kids who always knew what they were going to be. Yeah, one of those. I always wanted to go into medicine. It's probably because my mom was a nurse, my grandfather, great grandfather, eye surgeon. So I was in that environment, you might say. On top of that, my grandmother had epilepsy. So I was always hearing about her horrid stories of what happened during her seizures. And I wanted to help her. I was fascinated by what was going on and I wanted to do something about it.
Yeah.
So there was really no other option besides medicine. So you might say I was groomed to go into it, but I enjoy what I do. And I don't have regrets about doing it. I entered the magnet school for the sciences and health professions at age 13. I started volunteering at a neurology office, same age. I went on to graduate college, and then at age 18, I was the youngest, medical student for my class. And that's when things kind of changed. Up until then, I thought I would go into neurology. And as you mentioned, I'm not a neurologist, although I kind of sort of do neurotype stuff. I was assigned a mentor. So in my med school, we were each assigned mentors, and this is a person who helped us cultivate our bedside manner and kind of lead us through our patient interactions, tell us what we were doing wrong, and kind of help it guide us into becoming better providers.
Yeah.
And I was lucky enough to be assigned a doctor in rehab. And I grew real close to her. And one day she looked at me kind of funny and she said, Tanya, what are you going to go into? And I said, neuro. I'm going to be a neurologist. And she looked at me even more funny. And she said, don't do that. Go into rehab. And I was confused. I
Right.
said, I just said I wanted to go into neurology. I have no interest in addiction. And she said, no, that's not what I'm talking about. I'm talking about physical medicine rehab. You get to do neuro, but you also get to do more than just diagnose. You actually get to help get the patients better and see them through to happier states. And you actually get to get your hands a little more dirty than just neurology.
Yeah.
And luck, serendipity, whatever you call it, I so appreciated her. And yeah, so that started my path in physical medicine and rehab.
Wow. It's always interesting to hear, how a lot of, our colleagues sort of enter the field of medicine. And one thing that always resonates with me, because I share, sort of a similar story, is sometimes there's an event that happens, whether it's an adversity, or someone in your family sick or dealing with something that sort of sparks that interest, right? So, for you, it was your, relative with the epilepsy. For me, it was my grandfather passing, at an early age from a heart attack. And I think that does something to the experience,
Mhm.
of, us kind of moving in that direction. And then having that mentor, which is also,
Mm.
equally as important. And I'm going to tell you, like, physical medicine and rehab was something that never was really talked about a lot.
No, it's a
I
very
mean,
small
'cause
field.
yeah, and, it was not until years later when I became a physician that I realized that it was a whole field, like a whole specialty, like
Mhm,
a whole thing
mhm.
that a lot of us just don't get exposed to. So, yeah, so thank you for coming on and sharing your journey, because I would love to have other people hear about that and the importance of the work that you do as well. Yeah.
Yeah, that is for sure one of the challenges of the field. The field's been around since the World Wars. We had a lot of soldiers coming back with, um, arms or legs blown off, head injuries, all these disabilities, impairments, and the field developed as a result.
Mm.
But still, after all these years, people still don't understand what we do and what we offer in our services.
Yeah. So why don't you share that with us? Describe a day in your life. Like, what does that look like?
So, as a medical director, I split my day into two halves. The first part is all patients. I see my folks, typically patients with stroke or brain injury. I also do spinal cord and some other things,
Mhm.
but very brain heavy. I am a brain injury medicine rehabilitation doc, and that's my focus. So I see the patients, and then I also meet with the team. That includes the therapist, PTOT speech, the nurses, the neuropsychologist, case manager. We all meet together and we talk about the patient's challenges and we brainstorm on what we can do to overcome those challenges and to get the patient home safely. That's the first half of my day. It's all about the patient. The second half of my day is all about the staff. So when I came on board as medical director here, I invited everyone to please come to me. And this has taken up a lot of my day, but please come to me if you have issues and suggestions on how we can do things better.
Mm.
And they do that. They took that invite. There is always knocking on my door. So I have a whiteboard from one wall all the way to the other wall. Huge. and it is chock-a-block full of things that I'm working on to make the place, make our unit, make our hospital a better place. Um, and that might be in terms of patient care. It might be in terms of interacting amongst the different disciplines. Um, and basically a focus on efficiency, making our culture thrive. And ultimately, that kind of funnels down to patient care. So, indirect to patient care,
Mhm.
because a happy workplace is noticed. People notice that, especially patients. They notice when people enjoy what they do and they appreciate that. And happy people provide better care.
Mhm. Yeah, absolutely. Yeah, and I think, in the work sometimes that I do on discussions that I have with other healthcare leaders, one of the things I think that most people sort of, if you want to use the word complain, but complain about is not feeling valued or not feeling heard, right? Or, no one's listening to what I have to say. So the fact that you've opened that door for that, I think is huge and speaks volumes for your style. So tell us a little bit about that leadership style. Like, what is your leadership style? How do you get your team motivated? How do you, kind of manage the team that you have?
So, my leadership style is something I call a round table style. So, everybody around me has a voice, um, no matter what the position.
Hmm.
And that voice is just as valid. And I try to hold space for that and encourage people to bring up their ideas. And if people are quiet, I'll try to recognize that and try to get them out of their shell. And sometimes people think things and they won't say things, but they have tells. And I can call them out on it and say, I see you're thinking about something. What are you thinking about? And try to encourage them to speak up. So that's my style. And sometimes I notice that if I notice that somebody is being spoken over, I might go back to that patient, that person, that coworker, and say, "Oh, you were saying something," and just kind of reopen it up and just encourage them to speak what they have to say. I will say, when I first came on board, one of the things the nurses told me were that they felt they didn't have a place there. They were doing all the work, but they had no say. They did not come to the morning huddles. Um, they did not feel appreciated.
Wow.
Okay. All right. So we changed that. So they now attend the morning huddles. They speak in regards to their experiences with the patients, which is considerable considering that they see the patient more than anyone else, more than me, more than the therapist.
Right, right.
They're with the patients. Okay. So now they speak up and they feel like they have a sense of agency in the care that they execute, and they're happier for it. And people notice that.
Yeah, yeah. Yeah, that's amazing. And I think just based on what you shared with us, I heard three things. So one is active listening. So you have to be, in a space where you're actively listening, right, to your team. Um, and the other is just, giving space, for them to speak. Reading the room. So you're
Mhm.
recognizing, right, when people are not speaking up. And then you're actually like putting these things into action, right? So you're
Mhm.
actually doing something about it. So those are all, some wonderful qualities. So what would you say then to other leaders who may be having, problems with kind of corralling their team or just, maybe having some issues with team collaboration development or, anything in general? What advice would you give to leaders?
If there is an issue with team collaboration, my recommendation would be to throw those people together. So let's say the nurses and the therapists are kind of at it. And I'm not saying they always are, but let's say and there's a situation, I will put them together and say, look, there's an opportunity here to make things better. It's not running smoothly. So, how about you two or three get together and try to come up with a solution, and I'll help you along the way, and we'll try to iron things out. And, those people who might be at each other's throats, they might end up being the best friends because they're actually talking and getting to know each other afterwards.
Yes. I love that. I mean, I think for a number of reasons, right? Because as a leader, it kind of removes you from taking on that responsibility, right? From having that that extra thing to do to try to fix the situation. You're allowing them to do it themselves. And
Mm.
then I think there's just such a huge amount of accomplishment that comes out of doing that for them, right? When
Mhm.
they come to some sort of agreement. So I
And they have
absolutely
something they're proud of.
proud of.
Mhm.
Yeah, yeah, absolutely.
I will give you an example if you would like.
Yes, yes. Please share. Please share.
Okay. So here's an example. Uh, Nurses were getting upset because their diabetic patients, our diabetic patients were getting hypoglycemic. Now, the main reason that they recognize, because they're always with the patients, is because they were getting physical therapy before breakfast.
Hmm.
Okay. So a diabetic has to be very careful with their blood sugars. And exercise, if anything's going to drop a blood sugar, it's going to be exercise and then not eating on top of it. They recognize that. The physical therapists, not so much. They do what they can. Everybody's kind of weak in rehab. But it's the nurses who are checking the blood sugars and saying, oh my God, this person is not doing well. So, they're kind of there's some complaints. Oh, you can't take the patient. They haven't had breakfast. And the therapist is like, well, they have to do the therapy. Medicare requires 3 hours of therapy a day. We have to do it. They're scheduled for it. So putting them together. Okay. And what did they do? They adjusted the schedule. No physical therapy before breakfast. And for those situations where breakfast was late, we reached out to the nutrition department, the dietary department, and said, look, sometimes breakfast comes in a little late, and we really got to get these people on their therapy schedule. So, what did they do? They stocked our fridge with diabetic healthy meals
Hmm.
that they could have if they were running late. So, things worked out and everyone's feeling a sense of accomplishment. Our rate of hypoglycemic episodes dropped by 50%.
Wow. Wow. That's amazing. I mean, just what, a little, coming together, right, and collaborating, putting your heads and minds together, and everyone bringing their perspective of what they're seeing, and then coming up with a solution. Um,
Mhm.
yeah. Wow. That's a great story. Thank you for sharing that.
Sure.
Yeah. So thinking about just healthcare in general, you are dealing with, obviously some vulnerable population and people
Mhm.
who really need care and need the care, of others. What are some challenges you think that you face, and what are some things or suggestions you have maybe in sort of helping with those challenges?
So there are two overarching challenges I feel are in my field. Number one, I think I've already alluded to this. People don't know what rehab is and they don't know what we do. And it's astounding how often I hear about patients who've had strokes or
Mm.
amputation, and they go home when they don't feel safe, and then they fall and they end up with a brain bleed or something terrible. And then finally they'll filter down to me, and I'm trying to help them on the back end. So that is a huge challenge. What I'm trying to do is educate people. I go to the different departments, different hospitals, and I tell the providers what we do, what our services are. Whether they come to us, to my department or not, is besides the point. Just teach them what we do in rehabilitation. And that way, when they see the need, they can speak to it
Mm.
intelligently and make the recommendation rather than putting patients at risk. So that's number one. Um, and unfortunately, there is not that great a resource in figuring out where the rehab hospitals are.
Mm,
So I'll send you a link if you don't mind posting it. The best one I could find is put out by CMS, Center for Medicare and Medicaid Services. And basically, you can type in where you are. And on the left hand side, it'll have inpatient rehabilitation facilities.
mm,
And that way you can figure out where's the closest one to you. And if you or your loved one are in a situation where you've had an injury or a medical problem and you need help, then you can look and see what options there are. Okay. So that's one challenge, just the lack of knowledge in terms of what services we provide.
mm.
And the next one is insurance.
Uh,
And I think all doctors feel this, but I feel like rehab, particularly the rate of denials for inpatient rehabilitation, has increased by multiples, hundreds of percentages over the last few years. Some rehab facilities are actually closing down.
mm,
And a good part of my day is fighting for the right of a patient to come to our facility and be allowed the opportunity to get better and go home in a safe manner rather than just being thrown into the fire.
mm, mm,
Yeah. Having worked abroad, I can tell you there are different options to contemplate. Here in the US, we kind of seesaw back and forth between private care and Medicare for everybody. Okay. People over 65, they already get a universal health coverage through Medicare, right? Well, it doesn't have to be one or the other, but it's going to take some work. When I was in New Zealand, I can say that their health system was something to be admired. They had a dual type system. So what that means is that everybody, even aliens to the country, immigrants, had some sort of health coverage.
mm,
If there was something catastrophic that happened, they would get the care they need. Okay. But there was also a private sector.
mm,
So if people wanted care that was quicker, if they didn't want to wait, let's say a few days for a CAT scan, they wanted it right then and there. They did. They had private hospitals, private options.
mm,
Okay. And because everyone already had the universal coverage, the cost for the private coverage was extremely reasonable.
wow.
I paid $35 a month. Okay.
Thirty-
Yes. Yes, for good coverage, okay? Now, I can tell you, having had my own business, when I was paying for my care, I mean, for just $1,000 a month,
Absolutely.
okay? That's the discrepancy is unbelievable.
Mm.
So there are other options out there, and we don't have to be at each other's throats to say, one is better than the other. There's a happy medium, and I think it's going to take some work, but if we recognize it, maybe we can get there.
Yeah, absolutely. Absolutely. I think it's about exploring, right?
Mhm, mhm.
And looking at other options. So, absolutely. What are some pearls as we wrap up? What are some pearls that you can offer to other leaders? You shared so much with us today, and I think a lot of it definitely resonated with me, and I'm sure will resonate with the people who are watching. But what are some pearls that you can offer to other leaders?
First of all, figure out your priorities. Okay. Um, Figure out what is important to you. I'll share my priorities. I have three of them. Number one, what I do has to be worthwhile.
Mm,
Okay. I don't want to do it if it doesn't matter.
yeah.
Okay. Number two, I want growth in what I do. I don't want to be doing the same thing every day. I don't want to feel stagnant.
Mm,
Okay. And three, I want some balance in my life.
Mhm.
Yeah. I want to be able to have time to exercise. I want to have an hour or two to spend with my family. I want to have the opportunity to sleep through the night, a good night's rest. Um, I've had positions where I had to choose one or the other.
Mm.
Okay, well, you can't have them all. And I
Sure.
don't think that's the way it should be. So I recognize that priority and I try to align myself with actions that would recognize those priorities and make them come to fruition. Okay, so that's number one. Kind of leads to number two. Think about what you do and do it with intention. Okay. I know some people who kind of go with the flow, and that's okay if that's what you want to do. If you want to live a life where you're just kind of swept along and you want to experience everything, that's okay. That's if that's your priority and that's your intention, then wonderful. We are set afloat on an ocean of possibilities.
Mhm.
Okay. And you can go in any direction. So it's important to recognize where you want to go and put up your sails and adjust them so that you can actually get there. Okay. And then number three, do what you can to cultivate your joy and happiness.
Mhm.
Now, this sounds wishy-washy to some people. Oh, she wants to be happy. How how sweet.
Right, right.
But as I mentioned before, happy providers provide better care. Okay. You can't offer someone a drink from your cup when it's empty.
Yeah.
Okay. So I do the best I can to make sure my cup overflows so I can share that with people, so I can be generous with people. So I'm not coming from a place of lack. So those are my recommendations.
Yeah. I love those. I love all of those. Priorities, definitely setting intention and then just making sure what you do fills your cup.
Mhm.
Yeah. Yeah. I think those are wonderful. Well,
Thank you.
thank you for sharing those pearls. Thank you for sharing all the wisdom that you shared in terms of your leadership style and sharing your journey with us. And if people want to learn more about you or follow you, where can they find you?
Well, I am on LinkedIn, and I can send you my email address. And if anyone has a question, they are welcome to reach out to me. I'll send out my personal email.
Okay. Oh, I love that. Thank you so much. So I am definitely looking forward to staying connected with you and following your journey as well. And I will have that link for everyone that you mentioned about the CMS facilities. I think that's a great resource. And I look forward to, yeah, continuing to be a part of your journey.
Thank you, Dr. Lisa. This was a pleasure, and you are a joy.
Oh, thank you so much. Have a great rest of your day.
Bye bye.